Is joint cavitation from chiropractic adjustment safe for OA? Imagine hearing that familiar pop during a chiropractic session and wondering if it's safe, especially if you have osteoarthritis. Many people ask if the cracking sound from joint cavitation is harmful for their joints. Well, let's look at what really happens during these adjustments. When a chiropractor performs a joint adjustment, they often create a quick, controlled force to the joint. This causes a sudden change in pressure inside the joint, which makes gas bubbles in the joint fluid collapse or pop. That's what creates the cracking or popping sound. It's not the joint breaking or getting damaged. For people with osteoarthritis, this sound is often mistaken for something harmful. But research shows that the popping itself does not cause or worsen osteoarthritis. In fact, when done by trained professionals, chiropractic adjustments that include joint cavitation are generally safe. These adjustments can help reduce joint pain and stiffness, which are common in osteoarthritis. They can also improve mobility by loosening up restricted joints and increasing range of motion. Many patients find that these adjustments relax muscles around the joint, easing tension and stress. It's important to note that the sound is not an indicator of a successful treatment. The real benefit comes from the precise movement of the joint, not the noise. Some chiropractors use gentler techniques called joint mobilization, which involve slow, repeated movements without cracking sounds. These can be especially helpful for sensitive joints affected by osteoarthritis. Overall, joint cavitation from chiropractic adjustments is safe for osteoarthritis when performed correctly. It can help improve joint function and reduce pain without causing harm. Patients with osteoarthritis should seek care from qualified chiropractors who understand their condition and avoid excessive force. This way, they can enjoy the benefits of chiropractic therapy safely and comfortably.